In our monthly checkup today, we are talking about measles and the resurgence of this preventable disease following a number of outbreaks across the U.S. New Hampshire Public Health Director Dr. Jose Montero joins us today in our newsroom to talk about this. Why have we seen kind of this resurgence of the measles?
We are quite an interconnected world nowadays. Everything is a flight away. We know that there is measles in Europe, there is measles in Africa or Asia, so it's easy just to come here, and these populations who may have the disease hit pockets of populations that are not vaccinated, and we see a spread from there. Recently, like a month ago, we reached an all-time high for this century, 514 cases of measles, something that we haven't seen since the 20th century.
And why do you think that is? We were kind of talking in the commercial break there about the fact that there are some families that are deciding to not vaccinate their children. Could that play a role in this?
Certainly that is an important factor. We have seen these diseases spreading around those pockets and from there jumping into other populations. In New Hampshire, we are quite fortunate that our population believes in vaccines. By the time that they are a year old, 94% of the children have all vaccines. By the time that they reach kindergarten, 98% of the kids have all of the vaccines that are mandated. That gives us a high level of protection. But still, we may see cases every now and then. In New England, I know that Massachusetts and I think Connecticut have reported cases out of this increase. Ohio had 360 cases with 10 kids who were hospitalized. 10 people who were hospitalized. So there is a risk, and we need to maintain our approach to vaccination.
So far, though, no case of measles in New Hampshire.
No, not this time. We haven't had a case for a couple of years.
But we have seen some pertussis cases, right? Pertussis
has been quite prevalent in our state. We have between 100 or 200 cases every year. This year so far we had 20, but there are states like California who had to declare an emergency. We have seen 4,500 cases and at least 3 kids died. That is what is important. We tend to forget that these diseases are quite severe, and we need to make sure that, like in New Hampshire, we have high vaccination rates for our children, but when we're talking pertussis, we need to make sure that the parents are vaccinated. The mother and their spouse and any other caretakers need to be vaccinated for pertussis, so we prevent that spread to kids who need time to develop their immunity after they get the vaccines.
Really quick, what are the symptoms for the measles? Getting back to that right now.
As any other disease, some inspecific at the beginning with fever, malaise, but then you get blisters, the specific lesions that you see in your skin or in your mouth or your red eyes that are the most characteristics. You had a kid with fever and all of these young age, call your doctor, call your healthcare provider, get them there quickly to provide the rapid care that they may need at that time.
Okay, let's hope that we do not have a case of that. Thank you so much.
Pleasure.
We appreciate it. And we want to be right back.